So for those of you that have interacted with infants, which is children less than 1 year old, you've noticed that whatever they see, they want to put in their mouths, right? So the risk of this group of children choking is very, very high. So as a new parent, as a caregiver, or anyone who interacts with this group of children, you need to know exactly what to do when the child chokes, because it can be quite scary when you see it for the first time. So you need to pay attention to this video and know exactly what you're going to do in such a situation. So when you notice that the child is choking, what do you do? So the first thing you do is that you look at the child and you open the child's mouth, right? If you can see whatever is causing the choking, then you can remove it. This is a very, very important point. If only if you can see what is causing the choking, should you put your fingers in the mouth to remove it. If you can't see what is choking the child, don't push your fingers in the mouth. Why? Because you might push whatever is causing the choking deeper into the airway, and you might worsen the situation. So remember, only put your fingers in the mouth to remove what is causing choking, only if you can see it. If you can't see it, don't put your fingers in the mouth. That is very, very important. When you look into the baby's mouth and you can't see anything causing obstruction, but the baby is still choking, so in this case you quickly get the baby, put the baby on your arm, let the baby lie on his or her stomach, on your arm, support the head on your hand, as you can see on this picture up here. And using your palm, just hit the baby in the middle of the back. Just give good 5 blows, or continue doing it until whatever is causing obstruction comes out. So by you hitting the chest, what you're doing is you're causing pressure in the lungs to force the air out, and that will also push out whatever is causing obstruction. Okay, so the second thing you can do in such a situation is that in the same position, stretch your hand out, let the baby lie now this time on the back, right, on your arm, and support the head on your hand. Now in the middle of the chest, just using your two fingers, press the middle of the chest. Okay, go no, not too deep, but you can press, to a significant depth to cause enough pressure in the lungs again to force out whatever is causing obstruction. All right. So you have to know this information very, very well, because this can be life saving.